Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, let's hope he concurs, Sam. the
Say
skeleton.
no more. Say
So
no
today we're going to
more.
talk about how to use the massage gun on patellar tendonitis. So what is patellar tendonitis? It's an injury to the tendon.
Whoa!
I got it
Look
marked
at
off
yours.
there,
That
yep.
baby is in rough shape.
So it's a tendon, it's a thick tendon that
Yeah.
attaches the patella to the tubercle. I could say it.
So the
bone.
the shin bone to the kneecap.
Yeah. And you got all your quadricep muscles, the four muscles that blend together and attach to the kneecap. And then it attaches there. So it provides like a lever arm.
Yep.
So you can straighten your leg.
It's a sesamoid bone. Is that
There,
the
right.
Yeah,
Yeah.
I remember
Very
that from
good.
school.
So you can straighten the leg. It's involved with jumping and running and kicking.
Pretty much any weight-bearing activity.
Yeah. And in fact, patellar tendonitis is known as jumper's knee. And it's very, common in people like with basketball players or volleyball players or, well, if you do the high jump, obviously.
Sure.
So
Oh, yeah. Yeah, so should we show what it looks like on Sam?
Sure.
So obviously, Sam, we've got all the quadricep muscles here removed, but we do have the patella, the kneecap, is actually part of the tendon.
yeah, you can see it
Yep,
underneath
there it is. So we're talking about the infrapatellar. So we're talking about infra means below, the tendon from here to here. This attaches to the shin or the tibia, and
We
right there
actually
where
marked it a little bit,
yeah,
didn't we?
it's a little bit black there. Is that clear on that? Yeah. So that is the area that we can get tendonitis. In other words, that tendon becomes inflamed from overuse or excessive force on it. When it gets inflamed, it becomes painful, and we need to get that settled down. And you can get scar tissue that can build up around there and cause problems, and that's exactly what we're going to get rid of.
You actually get micro tears in
Yeah.
there, and yeah, then it starts to heal and forms the scar tissue Brad was referring to, and so we want to break that up, and we'll show you how to do that. In this case, also, just like we mentioned in the past, with some of our other videos, we're going to massage also the quadriceps.
Sure.
Just to make sure, if they're a little bit supple, they're not going to pull on the
Right.
patella and the tendon as much, and so you can maybe avoid this from happening in the first place, or prevent it from happening again in the future.
If those
So-
quads get tight and they have some trigger points to them and they wad up and tighten up, it's not going to do anything good for your
Right.
tendon down below the kneecap.
So we want to go ahead and massage the quadriceps. Now, with the quadriceps and using the gun, large muscle, so you can certainly use like the ball because that covers a little bit larger area. I like that flathead, Brad.
Oh, yeah.
It's a nice aggressive one, and it's actually covers a decent amount of area too. This one, if you have the smaller gun here, all of the guns come with at least 5 attachments. At least the Bob and Brad guns.
When you
And-
first start, you might use the air-filled one because it's a little softer, and if that's
Yeah.
not enough, you'll go to the more aggressive ball or even what we're showing here.
Yeah, and I actually I prefer going over the clothes.
Yep.
It's just more comfortable for me. These guns, by the way, some of them you have to hold the button for 3 seconds. Some people think they're broke because can't right away. But you can work along the fibers, and you can also go across the fibers, especially if you find a trigger point.
Yeah.
You
That's
can,
a tender spot.
yeah.
It knots up and it's painful. I'm going to just go on my skin directly just because it's easier to see. It's
Sure.
black on black.
Yeah.
That's just hard to see. So I'm going to work it. Got the VMO muscle here. We got all 4 of the lateral. And you're going to work wherever you feel a tight spot. You can go straight in, but that can be painful, particularly if you're going over your femur and you get in deep, like right there. Ow, I'm not going to do that. I'm going to go sideways.
Now, our recommendation is you keep working the area until that pain gets knocked down. I mean, if you have a tender spot in the quad, it means it requires some work. Now you can also do some flossing while you're doing this. Brad's on a stool. Actually, that'll work kind of well. He can uh, work the quadricep back and forth. I also have one of our knee glides here, and I don't know. Can you pan that far down? So what's nice about this is I'm going to flip it this way so the stand is up toward the back. So now my quad doesn't have to work that hard. In fact, doesn't have to work at all. I just let it go downhill like this.
Yep.
So I pull up with the hamstrings. I let the quad go down like that, and I can do flossing really easily without tightening up the muscle. So it just works quite well. You're going to be able to get a little more mobility in the
Right.
muscle. So, all right, let's go to the tendon itself now. Now the tendon, first off, let's talk about what you want to feel with this. If you start doing massage on it and it keeps getting tender and more painful, you stop. It's just give yourself about 30 seconds to try
Yep.
the massage and see if it plateaus or it starts to feel numb. Then you're good. Then it's a good sign. But if it just keeps getting painful, you're gonna have to wait a while, let
Sure.
it rest. So
So if we're looking on this, you can massage this. We're going to go across the fibers this way. You can do it with your fingers and get similar results. The same thing that Bob just mentioned. But your
Yeah.
fingers get pretty darn sore, especially if you're, 50 or older.
Yeah.
Those old joints just don't hold up. And, you really want to, if you get the good results, it feels better, numbish, you want to go over that, 10 to 15 minutes. And I guess
Yeah.
Syriac says 20, but
yeah, depending
that's
on,
a long time.
yeah, we usually break it up throughout the day.
Yep,
And
yep.
Brad came up with the idea to do the massage with the gun kind of from a sideways, in a sideways fashion.
You need the
So-
round head for that one. Typically, it works the best. So I'm going to go sideways right over that tendon, and of course on your leg. It looks like
Yeah, go
this.
directly on it once, Brad. So yeah, that doesn't
That
work
is
very well.
not what you want to do. You're
No.
going to have pain and you're going to irritate and have problems. So you're going to go this way and go across. It really does a nice job. So if my leg is, you want your quads loose. You've already worked those to loosen them up, and we're not going to go on top of the kneecap.
No.
It's below the kneecap, where we mentioned here in
Yeah,
that.
you don't want to go
marked
down
area.
too far either. You hit the
But-
tuberosity there.
You're just working
So-
bone, which
right.
is not needed at all.
Now, if that gets to the point where that's no longer painful and feeling pretty good, you can even get a little more aggressive with this head. I'm gonna turn it off just for a minute so you can see. This head here is more rounded, flat on the top, but on the edges here, it's fairly a little bit sharp. I mean, it's still rounded,
Right.
but it's a little more focused.
Yeah, the radius is tighter.
So what we can do with that then is, we're gonna go ahead and start it here. Why aren't you starting on me?
There
we
you
go.
go. You got to be patient.
You gotta
Bob.
hold it for at least 3 seconds. Now I'm gonna go across like Brad was doing, and I can really get aggressive on this now. And this is the one that'll take you home.
And
I
you
go
can
this
do
way
this
too.
with your knee bent like this, and it puts a little more as it improves, and work it this way as well. This is one area where you're probably, I don't know if you're ever going to go straight in. on it.
Right.
It's going sideways, and that's why if you get one of those massagers that just vibrate, it's not going to be near as effective as one that
Right.
reciprocates and has that travel like
Exactly.
like this
Those
gun.
are day and night. In fact, when these first came out, Brad, I didn't know that they had the transfers. I thought they just vibrated. And
yeah.
I'm like, well, that's worthless. Those
Right.
things aren't. But these all make all the difference. And
Right.
I mean, for
These
massaging.
are therapeutic. The vibrating ones just kind of, well, I shouldn't say that, but for our purposes, they're just kind of feel good things.
Brad and I have found that I had patients, about 50% would actually prefer the gun over our hands. I mean, they just,
Well, your hands, of
yeah,
course.
well, my hands, yeah, that's
Get
for sure.
them away from me.
Yeah.
I'm just kidding. There's a little story I got to tell you that I thought was pretty funny. I
Okay.
think the reason they have a 3-second hold on this is to help kids, young children, 2, 3 years old, so they don't push
don't
it
mess
and get
with
it
it.
going. You know what happened? My grandchild came out. He was 4 years old.
Oh, sure.
And he's down there playing with my stuff. I'm not worried about it. He comes over and he's got this gun and he's got it working.
Oh.
It's like, how do you know to hold it for 3 seconds? But you know those kids. They're
He's got the
smart.
mechanical mind
Yeah,
already. He got it from Brad.
I don't know, so I got to hide the gun from him. The massage gun, of course.
All right. This video, by the way, is a part of a series of videos on massage guns. And if you want to see the entire series, go to bobandbrad.com, go to the program section, and you'll find out we have a whole bunch of programs there,
Yep.
like on sciatica and tens and shoulder and hip and
Neck. You bet. So anyways, you go there, look at there's going to be a host of videos under each subject. Look at the title, it'll be about 10 minutes long. Pick out the title that fits your needs, watch it, and to boot, you'll get a PDF printout of the video with a complete review of everything we've gone through, so you can look at that very conveniently, so you don't have to keep going back and forth to your computer and looking at our sad
and
faces.
the cost is only $0.
Yeah, and we don't
Yeah.
even ask for an email.
yeah.
You know, that just doesn't happen.
We're trying to take away the friction. So it's very
friction.
simple.
Is that kind of a pun on words with the
Yeah.
friction of the
There we
massage gun
go.
on that patella?
By
There
the way,
goes.
you use that phrase to boot.
To boot.
That's like from the 30s.
Well,
or
it's coming
something.
back, Bob.
Yeah,
It's
right.
Don't worry, in another couple years,
All
everyone's
right.
going to be to booting.
To boot you. All right. Thanks.